Hi, I'm Chris Urquhart, publisher of Natural Awakenings. I'm here today with Lorin Carpenter. She's the co-owner of Radiantly Healthy Vitamin Infusion Drip Lounge with Dr. Rebecca Hunton of RHMD. Thank you so much for joining me today, Lorin.
Thank you for having me. I'm excited. We love Natural Awakenings.
We love to hear that. So with the vitamin infusion, what are some indicators that I may want to come and get a vitamin infusion, and how might it make me feel better?
That's a great question. I think that the majority of the people that find us or are seeking us out have underlying conditions that they know that they've researched that can be helped by vitamin infusion. So the range could be anyone from an athlete who does a lot of triathlons and is constantly depleting their vitamin stores and hydration. It could be, we've had pregnant ladies that rather than go to the ER to get an IV because they're so nauseous during pregnancy, have found us and know that they can come here just to do fluids and feel normal again. We have a lot of people that have autoimmune disorders that do regularly take vitamins, but find that when they do an IV, because they're absorbing 100% of what's put into their bloodstream, they definitely feel a boost from the vitamin infusion. We do have some cancer patients that come that use high-dose vitamin C in conjunction with other things that they're doing to manage a cancer diagnosis. We would never say that we treat cancer because IV therapy on its own is not a magic solution, but when combined with a lot of other lifestyle changes and even sometimes with chemotherapy and radiation, people see a really good result and have a better quality of life. The other people that we might see are, young people that are just trying to thrive and be as competitive as they can, whether it's in the workplace or in a sport, executives that are run down. And then like on the fringe, sometimes we get migraine sufferers that will come in on a regular basis because if you're hydrated, it's very difficult to get a headache. Even if it's hormone induced, hydration is the first domino to fall when it comes to a migraine. And then sometimes we get a hangover IV person every now and again, and that's usually someone from out of town that's seen this in Las Vegas or California or New York and knows that it's an option. It's actually very popular in Miami too. They have buses that pull up to nightclubs that will do IVs like at the end of the night. So it's a really wide range.
What if I've recently had a viral, like mono or a flu or something like that, while you're sick?
Yeah, so vitamin C is documented and known, and there's many peer review articles and PubMed articles about the fact that vitamin C in your system literally turns on your immune system. It's kind of like it's plugging in your white blood cell soldiers to go into battle. And that's why a traditional medical doctor would recommend emergency before traveling or if you're not feeling well. The dialogue is out there, even in traditional medicine, to talk about increasing vitamin C. The problem is if you take too much vitamin C orally, number one, I don't know if you're taking a quality product. That's a huge question out there for everyone. It's hard to know if you're getting a good quality vitamin C. But number two, if you take too much orally, it does cause a lot of digestive distress that's very uncomfortable. So kind of not worth it. Dr. Hunting carries a couple of vitamin C supplements that are very well tolerated. And the nice thing about buying vitamin supplements, either through her practice or just the brands that she recommends, regardless of where you choose to buy them, is that she's been in practice for so long that if you had low vitamin D and you took the vitamin D that she carries at her practice, she'll see you in 6 months, a year, 2 years, and she watches your vitamin C increase and then eventually level off to the level that's going to be comfortable for you. But we know that you're taking her supplement, so we know she has her own clinical data that the supplements that she carries are really reputable brands that people get good results from. But if you go to GNC or the supermarket and you pick a vitamin off the shelf, you don't always know what you're getting. And most people don't do regular blood work to know if it even made a difference. So with vitamin C IV therapy, whether it's the vitamin C that's in the regular Myers or a high dose vitamin C where we're mainly just doing vitamin C, we know that we're giving you pure ascorbic acid that's absorbed into the body that is turning on the white blood cells. So we might see someone with a cold or flu or a virus on a Monday, let's say, when they feel it coming on. We might have them come 2 times in that week. So maybe they come Monday and they get on Thursday. And usually by Sunday of that week, they may have had a couple of rough days, but we've absolutely shortened the severity and the duration of the virus that they're suffering from. And we see that all the time with colds and flus, especially, during cold and flu season. So we see results like that, on a monthly basis.
That's awesome. So you've talked some about supplements. So does an IV replace the supplements that you're taking, or in combination? How does that work?
I would say in combination, mainly because IV therapy is pretty cost prohibitive for someone to do on a regular enough basis to not take oral supplements. The problem with oral supplements is, again, you have to make sure you're buying a reputable brand. And then even if you are buying a reputable brand, we know that whatever it says on the label, so if it's a vitamin C that's 2,000 milligrams, you're lucky to absorb about 40% of that. So you're not getting the full dose that you're taking. You're really at the mercy of your own digestive system and your ability to absorb to see what you will absorb. A lot of people do have leaky gut or irritable bowel syndrome, or other digestive issues that don't allow them to even absorb the 40% that's kind of the norm if you're taking a quality supplement. So I think that IV therapy is good to use in conjunction with vitamins. So, everyone that is a patient of Dr. Hunton's and, an employee, we have our whole, vitamin thing of all the vitamins we take every single day. We still take them every single day, but especially right now during the COVID crisis, my staff is doing IVs every week to keep their immune system, in top shape so that we're able to come to work and serve the people that want to come in for IVs. So even on a day that you take your supplements, you can still get an IV. Also, it's never going to be contraindicated because IV therapy is water-soluble based vitamins. So if your body doesn't need them, you would urinate them out. So you're never going to take too high of a dose that it could hurt you in any way.
Awesome. So working so closely with Dr. Hunton, are there certain things, what types of conditions does she tend to recommend vitamin infusion for? What do you see most often?
Yeah, so most often when someone's establishing as a patient with Dr. Hunton, she does some preliminary blood work that kind of she does across the board just to get a baseline of someone's health. We always see her testing vitamin D3 levels. She usually will test your vitamin B levels, but once we know that you're low in vitamin B, B12, we usually don't routinely test again because once you start taking it, you always look like you're high. So kind of like if you were low in testosterone, if you started taking it and got a blood test, you would look like your testosterone is normal or maybe even high. But it's really just because you're taking it and you'd have to stop taking it to get that low level again. Kind of not worth it. Vitamin D, definitely. Vitamin B, she will look at magnesium and calcium and things like that if there's reasons to look in that direction. And then another common one that she looks at is called glutathione, and that's a master antioxidant. And we kind of correlate it to like if you had a bike and you lived on the beach and it got all rusty from being outside, you could go in, scrub it down, put some, Rust-Oleum on it and kind of shine it up and make it look good again. And that's kind of what glutathione does in your body. So free radicals kind of ravage the body, whether it's your skin or from the inside. And that's how our organs start to age, is that oxidative stress. So glutathione is an antioxidant that goes in and kind of cleans everything up and kind of moves the rust out of your system. When you're younger, you make it pretty efficiently, and most people, when they're younger, are in a pretty normal range. But as we age, we don't make it as efficiently. We make it in the liver. So if there's any reason that your liver might be compromised, fatty liver is a really, popular diagnosis these days, unfortunately, and it's not always a drinker that has a fatty liver syndrome. But, alcohol is a factor as well. So if you're someone that even enjoys a few glasses of wine a few days a week, at a certain age, you're not efficiently making the glutathione that you would need to kind of detox your organs and make sure that they're not aging at a more rapid pace. So glutathione is something that she tests on almost every person every time. because IV therapy is one of the main ways to get glutathione efficiently. There are a few supplements on the market right now. Dr. Hunton carries a couple that are somewhat efficient at giving your body glutathione, but usually your digestive system breaks it down before it can be absorbed. So until very recently, the only way to get glutathione would have been through IV therapy or a skin cream, but the skin cream smells like rotten eggs. So it's, so I've talked to a pharmacist before that said, the way that you use it is you put it on in the morning, kind of like a hormone cream, like maybe on your wrist or maybe on your side, and you spend your morning getting ready, and then before you leave, you wash it off, like it has to sit on your skin for an hour. But you couldn't go out with it on because you really would smell like a rotten egg.
Right. So not exactly super appealing to go the rotten egg route.
No.
So from a patient perspective, what is most popular from that patients come in asking for with IV therapy?
I'd have to say what's nice about the lounge, and the reason that Dr. Hunton and I opened it is because she's been doing IV therapy for over 10 years. And in her previous office, she had a small room with 2 infusion chairs like you'd see at a cancer center. And she would prescribe IVs to her patients based on their blood work and based on concerns that they may have had, whether it was Lyme disease or infertility. And so she would see a few patients a week for IV therapy, but it wasn't something that was offered to the masses. You had to be a patient of hers, and it had to be a conversation that you were having where you were wanting to be more proactive or wanting to do something more for your health before she would usually introduce it. So we opened the lounge because it's very well known that a lot of the IVs that we offer could benefit most people. So the Myers has been around since the early 80s, and Dr. Meyer, who came up with it, tested it on over 15,000 people in his practice. And the Myers has magnesium, calcium, vitamin C, riboflavin, pyridoxine, dexapanthenol, and methylcobalamin, which is B12 that's methylated. And if you're familiar with the Krebs cycle, if you went to medical school or nursing school, the Krebs cycle basically is the cycle within how your body makes energy to do work. So the energy that you need to walk across the room, the energy that you need to, sit at your desk all day, not necessarily the energy you need to work out, but just to live and thrive. So the Krebs cycle relies on all of the elements that are in the Myers to do work and make energy. And because of poor food quality, these days, if someone's not able to eat organic or they're eating a lot of processed foods just because of convenience, if they have any digestive issues, irritable bowel syndrome, leaky gut, which is becoming more and more prevalent, you're not necessarily getting all of those vitamins and minerals in the food that you're eating. And if you're not, and you're not taking a quality supplement, people see a very drastic difference just from doing the Myers. So we have an article that we share with our patients here if they want to learn more about it. And in the article, it talks about the 15,000 people that he tested the Myers on and how they got results, whether they had asthma or cold and flu or allergies or jet lag or athletic performance, whatever it was, the Myers seemed to be a fix for it. But really, the Myers doesn't fix any of that. It helps your body do what it's supposed to do in the first place, which is repair. And it is supposed to help you, your immune system's supposed to help you fight off allergies or asthma. So all it does is just give your body the fuel that it needs to address those issues. So the Myers is the most popular IV that we do. After that, I would say any of our hydration IVs, because when your body's hydrated, your immune system works better, you have more energy, you lose weight more efficiently, and it just kind of perks you up. So we have a lot of people that travel or used to travel that would come in for IVs before and after air travel. A lot of athletes that come in before and after races or triathlons that will do just hydration with B vitamins just to kind of pep them back up again. And then beyond that, we have an IV called the Mega Myers that's specific to our clinic. And the Mega Myers combines the Myers, which is our most popular. But we also have 2 other IVs that people are always intrigued by. And one is a fat burner IV, which helps your body convert stored fat into energy. And we have a beauty blend, which helps your skin glow and look more radiant. So most of the time, if someone came in and looked at the menu, we would suggest the Myers because it's a great place to start, a good baseline, but everyone wants to also get the beauty blend and the fat burner, and what do I do? So we kind of combine them all into one IV so that you can get all of the base nutrients of the Myers, the fat burning component of the fat burner, and then the skin enhancing, nutrients that are in the beauty blend. So the Mega Myers is up there as one of our most popular as well.
So you talked a little bit about Dr. Hunton writing prescriptions, and then we've also gone with what patients are choosing. So do you have to have a prescription for an IV or not? Or sometimes, how does that work?
So you don't, and that's why we open the lounge. So we offer about 12 different IVs that are on our menu that anyone can come in and pick one of those IVs based on what their concerns are and the results that they want to get. And I usually tell people it's, I would say it's very similar to walking into a health food store and picking up supplements off the shelf. Maybe you ask the clerk for some direction, but maybe you know for sure that you're there to get, B12. Or going into a smoothie shop and you're either going to pick wheatgrass or carrot juice, but they're both good. So, you just are trying to choose the best one to address the concerns that you have. So that's what the lounge is great for, because you don't have to establish as a patient with Dr. Hunton, which not everyone's ready to do yet. But if you are a patient of Dr. Hunton, she offers some specific testing. One of them is called a NutriVal test, and it tests all the nutrients that you have in your body. So if someone really is feeling depleted and run down, and Dr. Hunton has already taken a look at some of the vitamins that we normally test for, and she's looked maybe at your hormones, and she's looked maybe at your genetics, and we just can't find exactly what's going on as we peel the onion back, she'll go to the NutriVal test to see if you're absorbing nutrients, if that's maybe the problem of some of the symptoms that you're having. Based on the NutriVal, she can prescribe a specific IV just for you that addresses the things that you're mainly depleted in. And it could include nutrients that we normally don't offer, but if she sees that you're low in it, then we will add that to a specific IV for that patient. We also have a few patients that do chelation, heavy metal chelation therapy. And they do a specific test with Dr. Hunton to test the levels of heavy metals in their body. Usually mercury and lead are really high. We can also do chelation for arterial plaque. So if someone has some heart issues and they want to try and reverse that plaque that they have in the veins, we have an IV for that. But the patient-specific IVs, the chelation IVs, those are prescribed by Dr. Hunton. They're not offered to the general public because we have to make sure that you're healthy enough to do the IVs, because they do sometimes put some stress on the heart or the liver. And we have to make sure that after a series of IVs, you're following up with Dr. Hunton to see if you've had a good result from them and if you need to do more. The one exception that we make is if someone is working with an integrative functional doctor already, and we can maybe conference in with that doctor or just kind of confirm that they'll be following up. If that doctor prescribes an IV that we offer, we would allow that patient to come in knowing that they're following up with a provider that's, looking over their care.
Thank you, Lorin. I appreciate all that great health information. It's making me want to come and get an IV. Sounds really good. Plus, it's a great way to get out of the house right now and go to a safe, clean environment and be healthy at the same time. So I really appreciate your time today.
Thank you.
So if you'd like to connect with Lorin and the Radiantly Healthy Vitamin Infusion Drip Lounge, you can visit rh-md.com, their website, to find out more about it and peruse their menu. You can also give them a call at 321-243-1859. They're located on 5th Avenue in Indiana. Thanks again, Lorin. We appreciate you spending some time with us.
Have a great day.
You too, everyone. Be well. Stay connected.